So, good afternoon, everyone. Welcome to today's session on a topic that is quite sensitive and especially in recent times. And it's about mental health, one of the topics that we don't have a lot of conversations about. For today's session, we have an able resource person who would be able to give us all the information that is necessary to tackle this topic, especially for us young professionals in our workspace. We spend so much time in the office, about a third of our lives in the office. So it's very necessary to know how to also navigate mental health in the workplace. Then another percentage of our lives is spent, let's say, sleeping or at home. We also need to know how to navigate the mental health outside of the workspace and in our homes. Most importantly, we need to protect our mental health despite all the stresses that we have going on, whether it's work, change in life choices, or our health in terms of finances, especially in the economy, the way that things are going now, high cost of living, we are unable to figure out certain life choices. All of these things affect our mental health. And so it's very important that we stay connected with our entire being, body, mind, and soul. So it's an honor to have our guest speaker today for today's session. She's an expert on the subject, a specialist psychiatrist, and a weight management coach. She's worked at 37 Military Hospital, Ghana Police Hospital, and St. Joe's Specialist Hospital. She also volunteers as a medical officer at Ankafo Psychiatric Hospital. She's very passionate about community outreach and mental health advocacy, and that's why she's perfect for the topic today. So, ladies and gentlemen, help me welcome Dr. Adjoa Jemra, and she'll be delving into this very sensitive topic today. So, Adjoa, Dr. Adjoa, the floor is yours. Hello, Doc. Can you hear me?
Yes, I can hear you now.
Okay, perfect.
Can I start?
Yes, you may proceed.
All right. So thank you very much for the introduction. We'll be discussing how to protect our mental health. It's important that in as much as we talk about diet and exercise to maintain good physical health, we also discuss ways in which we can maintain sound mental health, because really there's no health without mental health anyway. All right, so this is just a teaser on the reasons people do not want to talk about their mental health. Most of the time is because we are scared of being judged, or we are scared of being labeled by the condition, or we are afraid that people will pity us, amongst others. So the objectives for the discussion will be as follows. We'll discuss mental health, we'll define mental health, and then identify common psychosocial stresses, of everyone in general. And then discuss ways in which we can manage these stresses, look at ways of protecting our mental health, and then explain how our thoughts affect our behavior. This will be the outline of the presentation. So the World Health Organization defines mental health as a state of well-being encompassing 4 things. So the important thing to note here is that your mental health, by definition, is your mental state. It's not how you have been over the last few months or few years. It's how you are as we speak. It is why we say that everyone can have poor mental health at one point in time or the other. So it's a state of well-being in which the individual realizes his or her own potentials or abilities, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. I am sure that by this definition, most of us would have realized that yesterday, 2 days ago, even maybe today, we may not have had sound mental health. Now, it's also important to note just by this definition that having sound mental health is not the same as being known to have a mental illness. What I mean is that the fact that someone has a mental health diagnosis or someone is known to have a mental illness does not mean they're always going to have poor mental health. It also means that a person who has a mental illness can have better mental health at a time relative to one who does not have any such diagnosis. Mental health includes our emotional, psychological, and social well-being. And on this basis, the promotion, protection, and restoration of mental health can be regarded as vital in our individual lives. Mental health is a continuum, as I explained with the state. And so at every point in time, you can be at one point or the other. So starting from the best to the worst, we have green to red. So you have normal or healthy mental state, or sound mental health. In that case, you are of your highest level of functioning. Then life stresses happen, or life happens. And so you react, and therefore your function will be a little impaired, maybe not so significant as to cause others to notice. For instance, things like losses in general, loss of a job, loss of a relationship, loss of a loved one, can cause us to react in a way that makes us function a little less than our usual functioning. And when I say function, I'm referring to our social and occupational functioning. So how you relate with others and how you function at work, or if you are in school, how you function in school. Then there's the injured, where there's significant functional impairments. And then the last point of the continuum is when you are known to have a mental illness. And so this is a clinical disorder. It is why I said that not having adequate mental health is not equivalent to having a mental illness. It's also why I said that the fact that someone is known to have a mental illness does not mean that they are always going to stay there. It's a continuum, so you're not always going to be here. So these are some myths about mental health and what the facts are. So one major myth is that children do not experience mental health problems. The fact is that even very young children may show warning signs of mental health concerns. Also, it's known that most people who have a mental illness or a mental health diagnosis are known to have had signs and symptoms from childhood. And so it's not true that children do not experience mental health problems. There's another myth that personality weakness or character flaws cause mental problems. And this is usually seen when people say that mental health problems is for DBs, it's for dadaba people, it's for people who have it all. And so, I mean, kind of behavior. This is a myth. The fact is that mental health problems have nothing to do with people being lazy or weak. Many factors contribute. So yes, though personality traits may contribute, there are a lot of other things that factor in, like physical illness, brain injury, brain chemistry, life experiences, amongst others. Now, this is why we need to talk about protecting our mental state, protecting our mental health, keeping sound mental health. The prevalence of mental and substance use disorder worldwide is so huge. And amongst them, anxiety disorders and depression are the most significant, are the highest. So anxiety disorders are the most common mental disorders worldwide, followed closely by depression. It's very common to hear people say that, oh, his wasn't a mental illness per se, it was just depression. Or, oh, what happened to my mom wasn't a mental disorder, it was just anxiety. Now, this is to tell us that Even anxiety and depression are mental illnesses, just like bipolar disorder and schizophrenia. Why is mental health relevant to you? Because 1 in every 4 persons is affected by a mental health problem in any year. And 60% of adults with mental illness receive no mental health services in the previous year. It's only about 2/3 of children with diagnosable mental illness. Sorry, it's only about 1/3 of children with diagnosable mental illness that receive treatment. So there's a huge treatment gap, and there's a huge mental illness burden. What makes mental disorder or mental illness? There has to be a clear deviation from the norm. And so you should be seen to have changed. There should be a change in your emotion, a change in your thinking, and or a change in behavior. And this change should have a duration. So it's change over time. And it should be persistent. It should be seen in more than one setting. So the change in thinking, behavior, or emotion should be persistent. It should occur in a particular time frame, and it should be seen in more than just one setting. So not just at home, but at work as well, or at school as well, or in church as well. And this deviation should cause significant distress to the person and or the society at large. Usually the distress is a result of the disability it comes with. Remember, we talked about functional impairment being a result of mental illness. Now we're going to go straight to what some of the psychosocial stressors are. We talked about how stressors generally can affect our mental state, and we deal with stress all the time. Even promotion at work can be a form of stress. Pregnancy is a major source of stress. Getting married is a major source of stress. So there's good stress, there's bad stress. Stress is part of life, and therefore we need to talk about it and learn how to cope in order to protect our mental state. Stress is a natural response to situations that bring pressure. It's a normal psychological and physical reaction to the demands of life, and it arises when the people worry that they can't cope. So usually I am stressed when I am worried, or a person is stressed when he or she is worried, or they are worried that they can't cope with a change in life. Stressful experiences usually come with the fight, flee, or freeze response. Not everyone will fight or flee, others will freeze. So what are some of the psychosocial stresses we come across? There's pressure from family, friends, among others, to meet sociocultural standards. What do I mean by sociocultural standards? Social standards that pertain our cultural setting. For instance, there's the stress to get married or the pressure to get married when you attain a certain age. Then when you get married, there's a pressure to have children. And then when you have children, there's a pressure to have a second born or a third born. And if you have same-sex children, there's a pressure to have another sex. There's academic pressure, there's bullying at work and on social media. High focus on these sociocultural expectations at our individual levels can all cause stress. Now, the factors that contribute to stress are varied. There's past experience of stress, your personality traits, social support, presence of other stresses, among others. All these things contribute to how severe a stressful situation can take a toll on you or not. There are 3 signs of stress or forms of stress: emotional reactions towards the stressor, which can be behavioral, and then there are also physical symptoms, and then we can talk about signals from children. So the emotional reactions towards stress for most people would be anger. Most people, when they are stressed, are very irritable. Some get sad, especially when they feel like they can't cope and so they're going to fail. Others would be fearful or confused. In terms of behavior, there can be a lack of motivation to engage in tasks when we are stressed. We can decide that because we are stressed, all die be die, what can come can come. And so we stop everything and then let Jesus take the wheel, so to speak. There's also a lack of interest and avoidance of activities. And again, irritability and aggressiveness towards others. Physically, we can suffer headaches, we can have muscle pain, back pain, and then sleep problems. A lot of people are unable to sleep when they are stressed. Sometimes it's so bad that they only report the sleep problem, forgetting that it's a result of the stress they are going through. Children, when they are stressed, will have behavioral changes. They suddenly become problem children when they were previously not. And then you also notice changes in academic performance. So how do we look after ourselves? In the same way that a car needs fuel to drive, you need to look after yourself and keep your tank full so that you can keep going. What complications are we likely to suffer when we don't handle mental disorders? The main one is suicide. And we need to talk about suicide because one person dies from suicide every 40 seconds. So I'm sure we can have an idea how many people would have died by now since we started this presentation. And close to 800,000 people die by suicide every year. This is from the World Health Organization. And we are looking at people worldwide. In low and middle income countries like Ghana, 78% of suicides occur. So out of the 1 person that's dying every 40 seconds, and the 800,000 people that die every year, 78% of these people come from low and middle income countries. The suicide rate among men is 4 times that of women, although more women will report or come into the hospital with attempted suicide. 15% of all people with depression would attempt suicide or die by suicide. And men usually have more lethal ways or attempt suicide in more fatal ways. And so they are more likely to die when they attempt suicide than women. Among people aged 15 to 29, suicide is the second leading cause of death for both sexes. Among females, suicide is the second leading cause of death. And among males, suicide is the third leading cause of death. How do you know who is likely to attempt suicide? Now, I'm using the words attempt suicide, die by suicide because we are trying to decriminalize suicide. And so saying that a person has committed suicide is sort of reinforcing the idea that suicide should be a criminal offense. You commit a crime. And so if suicide is not a crime, then it's not something that we commit. It's something we either die by or attempt. So people who have had previous suicide attempts are likely to attempt again. People with substance abuse, any form of substance, alcohol, tobacco, shisha, marijuana, or weed, etc. People with physical disability or illness, people who are exposed to constant bullying, especially cyberbullying and workplace bullying, are also likely to attempt suicide. How do you know that this person, by their behavior, is likely to attempt suicide? They usually have a negative view of themselves. They usually feel hopeless about the future. And then they are likely to isolate or withdraw from everyone. So there are times when people have been concerned because someone has unfollowed everyone from social media, for instance, or is no longer posting as frequently as they would. All of those things are signs of social withdrawal. So it's not always physical. In today's world, we can depend on social media to notice if a person is being withdrawn socially. They also would usually talk about death and dying. I have a friend who, when she was suicidal, and she had no idea she was suicidal. In fact, because she was a Christian, when you tell her that she's suicidal, she'll say, no, I don't want to attempt suicide by myself because I don't want to go to hell. But of course, if I'm passing by the road and the car knocks me down, hooray, what are we receiving from this world at all? Heaven is a better place, you know, so they talk like that. And then they sometimes would feel like they are a burden on other people. So let me just die so that my relatives can have peace of mind. This is even more common in people with chronic illnesses. People who are less likely to attempt suicide are usually the opposite of the previous one. So when there's safety in a neighborhood, safety in the workplace, when there's closeness with caring friends, when people are able to achieve their academic goals or career goals, they are less likely to attempt suicide. That is, if they are able to achieve the targets they have set for themselves. It's important that this is individual based. And so it's not based on what you think as an observer. Sometimes as an observer, you think someone is a high achiever and so they've achieved so much, but that person is still feeling low, still feeling very hopeless about the future because they haven't reached where they expect to reach. And we're going to look at that when we talk about the cognitive distortions. So like I said, we don't want to be saying that a person has committed suicide. We want to say that they have either died by suicide or attempted suicide. Imagine someone attempts suicide and then the police says, Madam, it's a capital offense to take away your life. The court will sentence you to hang for attempting to commit suicide. Isn't that funny? How do we get help for people with emotional pain? Talk about it. Ask them. It's important to be very direct when you're asking about suicide. So are you thinking about killing yourself, for instance? It's a very appropriate question in this instance. It's more important to be direct than indirect. You worsen the situation when you're indirect because then it seems as though you don't think it's okay to do it. And so they are not likely to open up and talk to you about it. One way I go about it personally is to ask, do you sometimes feel like you're better off if you were dead? You sometimes feel like everything would be a lot better if you died, and they will tell you. Reduce access to lethal items or places for people who are likely to attempt suicide, and be there. Be there, listen carefully, and acknowledge their feelings. You see here that there's no point where it says talk to them. You have no business talking to anyone. You are asking in order to listen. It's important to listen. It's not about you. Many people, when someone opens up to them, talk about their experiences. You cry, you're lucky. You have just been unemployed for 1 year and you're like this. Me that I was unemployed for 5 years. It's not about you. Everybody is different. So listen, listen, listen. Then help them connect. So you can save the number on the screen, which is a National Suicide Prevention Lifeline number. And stay connected, follow up, stay in touch. Even after they have attempted suicide, stay in touch. So I'm staying on this slide for a little longer. You can take a screenshot. All right. Now, how do we maintain sound mental health? Self-care. We're going to talk about self-care in the subsequent slides. You need to engage deliberately in a leisure activity. Engaging in a leisure activity it's more of a responsibility than pleasure. utilize mature defense mechanisms. We're going to look at what that means, what defense mechanisms are, and what we mean by mature defenses. Establish circles of control. I'm going to talk about that, what I mean by circles of control. So maybe we can take a screenshot of this one as well, and then we'll discuss each one as we go. Use the stop, think, go approach. Avoid toxic positivity. Toxic positivity includes saying things like hustle, keep going. It's okay to rest. It's okay to sleep. Sleep is for the weak. That's all toxic positivity. Why do I do that? Positivity. So avoid that, and then stop cognitive distortions. Now, at this point, I'd like us to take a moment and reflect. What are some of the things you do to take care of yourself? What are some of the things your team, family, colleagues, etc. do to take care of each other? Self-care is not a luxury, like I said earlier. It's a responsibility. So this, I'll take them one by one. It's not too clear, but don't worry. This is the circle of control I was talking about, but I'll take them one by one and we'll discuss very quickly and move on. This is the stop, think, and go approach to self-help. So there's a problem, there's a crisis situation, there's a stressor. The first thing you want to do is stop. This usually would be helpful for people who would freeze during a stressful situation. But again, it's important to not freeze for too long. You freeze so that you think. You don't freeze and get stuck. So freezing isn't always good if they are getting stuck, but it's great if they are going to think. So take a pause, or help the person in the stressful situation to take a pause and consider which of the problems is most urgent. Everything is happening at the same time. Which one do I tackle now? So I'm going to work and I'm late for work and my car has stopped and I have a wardrobe emergency. Everything seems to be going very wrong on this particular day. Stop, think, and choose which of your problems is more urgent, is more pressing. Then, using the circles of control, identify which one you can control. So the circle of control, we're going to look at it again, but the circle of control is saying that which of the problems is outside my control and which of the problems is within my control. Inflation rates have gone high. Is it within my control? Prices of foodstuff is high. Is it within my control? Which part of it is within my control? Do I change my diet to manage my finances at this crisis time? That can be within my control. So that's what the circle of control is. So that the things that are outside our control, we stop worrying about them because really there's nothing we can do about them. And then go means act on whichever situation you think is pressing. Act on it. Or emergency. I'm using the word emergency here for stressor. So for instance, now there's a global crisis. There's a global economic crisis. That is the emergency situation at this time. Stay up to date with accurate information. So whichever information is coming at us or coming to us, we are using the CRAP approach. So how current is the information? So if you're telling me that inflation rate is so and so percent, as at what time? That's the currency. Then how relevant is this information to me? If you are giving me the information, if you're telling me what the inflation rate is today or what the dollar rate is today, what's the relevance? How does it fit into my needs at this time? Then who is the source of information? Is this information coming from Bank of Ghana or is it coming from Adwoa Jamra? How accurate is it? And why exactly does the information exist? What exactly do they want me to do with the information they are giving me? Eat well, get enough sleep, exercise physically every day. Now, when it comes to sleep, again, it's not a luxury, but a responsibility. It's important to maintain a good sleep schedule. Sleep schedule means, or maintaining a sleep schedule means going to bed at about the same time every day and waking up at about the same time every day. Sometimes you may choose to wake up a little later on holidays or on weekends if you don't have work. But on weekdays when you have work, maintain a normal sleep schedule. So if you're sleeping at 11 p.m. every day, keep at that. Don't sleep earlier or later, is what we mean by maintain a good sleep schedule. When it comes to exercise, it doesn't need to be vigorous. It's not about how much exercise you are doing, but the consistency, how frequently you're doing it. So it's okay to do something very little, but keep at it consistently. In this case, remember, we are talking about maintaining sound mental health. So you're not exercising to stay fit physically. You are exercising to stay fit mentally. What it means is that you are trying to pump blood into your brain. So the workout here, the exercise here is about pumping blood into your brain to keep you active, to keep you sound, to keep your mind sound. Establish daily routines and try to stick to them. So some people would have a planner, or some people will put it in their diaries, but have a routine for the day and try and stick with it. Minimize your use of over-the-counter drugs, especially sleeping tablets. It's very, very important. Minimize that. Minimize the use of caffeine. A lot of people would need to take coffee in order to start their day. Try and minimize that, because these over-the-counter drugs, these substances actually would cause a worsening of your mental state. So they cause low mood or depression, they cause anxiety, and they worsen the sleep problem that you think you are trying to fix by taking the over-the-counter sleeping tablets. If you're already taking these substances, it's important that you reduce the amount and gradually stop from now. So this is the circle of control. What can I control? What can I not control? And then everything I can't control, I take it out of my worrying and then dwell on what I can control. Then, even though the list of what I can control is many, I group them into what is more pressing to deal with. Try an activity that helps you relax. So the slow breathing, there's dancing, there's stretching, whatever it is that helps you relax. Yoga, praying, etc. So I like to pause here so that I get some feedback from everyone. What are the most common psychiatric disorders? Maybe you can just mention the first two and then we'll move on.
Anxiety?
Yes. And then followed closely by?
Depression.
Great, thank you. So, are you depressed or anxious? You are not depressed or anxious yet. What do? You protect your mental space, and that's all we've been talking about this whole time. If you are, consult a psychiatrist, consult a psychologist, or speak with someone you trust. It can be a counselor or a trusted guardian, but get help. Now, this is an ongoing debate. People think that spirituality and worsens people's initiative to seek help when they have mental health challenges. Others think it's actually better. So it is both. It's known scientifically through hundreds of research that people who have a faith are more likely to do well or get better when they are mentally ill and or physically ill. So having a faith is helpful, it's protective. However, it's also known that when this faith when people dwell more on the faith than the science, so that they forget the need to get help. And they think that so let's take Christianity, for instance. And so if you think that Jesus will make a miracle and you sleep and wake up and get well, forgetting that these miracles sometimes come through people or come through the medicines we take, or maybe the miracle is in the fact that the medicine exists, then your spirituality becomes detrimental because your illness is only going to get worse. Now we're going to look at cognitions and then what cognitive distortions are. We're going to end very, very soon. So cognitions are mental actions or process of acquiring knowledge, and understanding. It can be through experience, through thoughts, and through our senses. Now, here are some negative cognitions that I want us to talk about. I'll show them on the screen and then dwell on maybe 2 per screen. So filtering. People who filter dwell on tiny negatives and leave out the major positives. So I have a presentation with all of you today. And at the end of the day, maybe we didn't start on time, or maybe one slide I wanted didn't show. Because of that, everything was a mess. So I leave the presentation feeling very down, very low, and I think that I have failed drastically. I didn't deliver as I should have, because I am dwelling on the tiny negatives and leaving out the major positives on all the things everyone may have learned today. Then there's jumping to conclusions or mind reading, which my female people, we are very good at. Interpreting events negatively without proof. So I greeted her and she didn't respond. Therefore, she hates me. That's what jumping to conclusions is. Now, most of us are guilty of at least one of these things. And we don't even know that they are negative cognitions. They are negative cognitions because if we change them, we actually enjoy better mental health. We are actually more at peace with ourselves. I greeted her, she didn't respond. What if I decide, what if I don't jump to any conclusions and I ask, are you okay? Or I repeat the greeting in a louder voice. Maybe she didn't hear me. But no, I jump to conclusions and then I act based on whatever conclusions I have come to. And then eventually it affects everyone. Other negative cognitions include blaming. I suffer this every time. I see it all the time around me. And I suffer it because I'm a doctor and also because I'm a weight management coach. So I'm constantly dealing with people who need to change something to get better. It means that they are people who are likely to blame, because we only blame when we feel we don't want to take responsibility of whatever has happened. And so we would rather put the blame or put the responsibility on other people. And it's even worse when we blame others for how we feel. And so you made me feel bad. You made me feel low. It's important to realize that we are more in charge of our feelings than we think. How you feel is directly based on you. Nobody can make you feel any way. It's all you. So let's stop saying that people made us feel. Let's stop blaming others. Personalization. Feeling responsible for events completely or partially out of your control. So at work, again, I'm going to use this presentation as an example. So I'm the one doing the presentation. It doesn't go well like it should, and Amma thinks it's her fault. And so she is down the whole day because the presentation was a mess. That's what personalization is. So feeling responsible for events that are completely or partially out of your control. Then there's shoulds. Subjective ironclad rules you set for yourself and others without considering specifics of a circumstance. So you should do this, you should do that. It doesn't matter what the situation is. It doesn't matter what the circumstances. When you have such thoughts, you put a very, it's like having such high standards in a layman's terms. So you put so much pressure on yourself and you expect so much from yourself and from others, thereby making yourself very liable and making it very easy for others to disappoint you or for you to disappoint yourself. How do we stop cognitive distortions? It's important that we think about our thoughts. Until now, most of us didn't even know that these things that we are doing are a problem. So let's think about our thoughts. Replace absolutes. So once you focus on your thoughts and recognize a pattern, consider replacing statements such as always and nothing with sometimes and this. What it means is that instead of saying, I'm always messing up, you can say, I mess up sometimes. Instead of saying, nothing good can come out of this project, you can say, maybe we can look at what good can come out of the project. So that's what we mean by replace absolutes. And then define yourself and others. Try labeling the behavior rather than the person. So, or rather than yourself. So instead of saying lazy, you could say, because you didn't clean today, you can say, I didn't clean today. You don't need to say, I am lazy, because one action doesn't define you. Neither does one action define people. Search for the positive aspects of every situation. Now, there are times when my husband thinks I'm crazy, because this is one thing, and we are going to look at how sometimes you should look for your own strengths, your own personal strengths. This is one thing I do sometimes too well, and it's annoying. Like there's a clear problem, there's a clear mess, and I'm looking at silver lining, you know? So, and it's important to do that or train yourself to do that if you are not, in order to stay mentally sound. Even if it's challenging at first, what if you find at least 3 positive examples in each situation? Try it. It's so helpful. Look for the positive aspect in every situation. What the silver lining is. There's a global crisis. Okay, maybe this will help me manage my money better. Oh, okay. Necessity is the mother of invention, right? So maybe this is the one thing that will push me to start some business or to learn some trade or to monetize this leisure of mine, you know? So at every point in time, you're looking for what the good is despite the mess surrounding everything. Is there evidence to back up your negative thoughts? This also is very helpful for people who like proof or people who are more academic. If you find that you are that kind of person, this will be very helpful for you. So whenever you find yourself thinking something, ask yourself, is there proof? I greeted her and she didn't respond. Therefore, she's angry with me. Is there proof? Cognitive dissonance really is experiencing 2 cognitions that are not compatible with each other. So I'm looking for an example that is anything else to keep. Yeah. So for instance, I have to be at work early. So okay, usually in Ghana, when you are the boss, you are the one that comes late. Everyone else comes before you. So you come and then, yeah, so usually that's what happens. But you also know that you should be early because it's bad to not be early. So even though you are usually late, you are trying to be early. This is what cognitive dissonance is. So you're experiencing two cognitions that are not compatible with each other until you change your thinking, until you decide that I want to be early, not because I just have to show up early, but because it's important for me to be early, to stay up to date with whatever work I'm doing. Until that becomes a thought rather than just a behavior, you're going to have cognitive dissonance. So usually we change our behaviors without necessarily changing our thoughts, and we find ourselves in this problem. Another example is if I have a problem with a colleague at work, rather than changing my thinking about that colleague and then waiting for the change in thought to affect my behavior, I'll rather quickly change my behavior so that others will not see what is going on in my head. And that's what cognitive dissonance is. Usually when you have any psychosocial stressor or mental health challenge, one of the main therapies that will be done for you is cognitive behavioral therapy, where we are trying to help you change your thoughts in order to change your behavior. Now, I talked about defense mechanisms. Defense mechanisms are things we do to protect ourselves. The self in psychology, psychiatry, mental health is known as the ego or the person. And so anything you do to protect that ego is a defense mechanism. There are a lot of immature defense mechanisms that most of us have seen or have done once or twice. The commonest example is when, say, your boss shouts at you and you can't shout back at him. And so you go and shout on your subordinates, or you go and shout on your wife, or you go and shout on your children. That's a defense mechanism, and it's immature. So we're going to dwell on the mature ones in order to stay healthy mentally. Humor. Laugh at yourself. Laugh at yourself in every stressful situation as much as you can. Look for the funny aspects of what's going on. That's what humor is. Anticipation is, there's a global economic crisis. You can anticipate that it's going to get worse rather than dwell on how bad it is today. And in anticipating that it's going to get worse, you put in, sorry for the typo, you put in mechanisms, or you start looking at what you can do to cope when it gets worse. So that's what anticipation is. So that by the time it's actually that bad or it's actually worse, you are ready. Suppression is deciding to dwell on the issue at a later time. But it's important to not confuse it with repression, which is an immature defense. In repression, people never go back to the problem. They don't go back to deal with the problem. And that's what happens usually in cases of rape and other very traumatizing events. They almost eventually forget the problem. And the truth is, they actually do not forget. It goes down into their subconscious and it shows in their behavior. It shows in certain mental health challenges they are likely to face in future. And it's only in talking to them and going back in the history that you realize that they have a repressed situation. So repression should not be confused with suppression. Suppression means I'm having an IVF treatment and I'm going to see my doctor today for to test for pregnancy. But I also have an exam today. Okay, I'll go and do my exam first and come back to the doctor after the exam. That's what suppression is. So I'm holding on. Usually, there are people who say they are Christians, and I'm saying that in a very amusing way, do it very well. And it's seen in African movies all the time. They will say, oh, that's what suppression is. So I will deal with you, but wait for me. Let me go and come. So in suppression, you are telling the situation that let me go and come and I will deal with you. But it's important to return to deal with it. Altruism, there's a question mark here because there's an ongoing debate as to whether there's actually any true altruistic behavior. Altruism is doing good without expecting anything in return. Now, this is questionable because most of those who do good expect that God will bless them. In that case, is it true altruism? Because you're expecting something back, except you're expecting it from God. So if you are doing good, do good. But saying that you are doing an altruistic act or saying that you are engaging in altruism is saying that you are doing good without expecting anything in return, whether from God or from man. Again, people say that the fact that Jesus died for our sins. I use a lot of Christian examples because I'm Christian, so please pardon me. The fact that Jesus died for our sins was an altruistic act. Is that really true? Especially if he was dying for our sins so that we will be saved. There was an outcome, an expected outcome. And so that makes it questionable as to whether it was altruistic or not, but at least we have an idea what altruism is. Then there's sublimation. Sublimation is, the biggest example of sublimation is when someone has the tendency to violence. If someone has the tendency to be violent and they pump that energy into an activity or a performance that allows violence. For instance, I have the tendency to violence, and so I become a boxer. That's what sublimation is. So that now it's not seen as a bad thing because that is the nature of my work. You can also talk about sublimation when you look at people who have the tendency to be thrilled by seeing blood. There's a group of people like that. And it can be normal. I'm saying it can be normal because if you attach a mature defense and you end up working in healthcare or being a surgeon, for instance, where you're seeing blood on a daily basis and saving lives, then that's what sublimation is. So these are mature defenses we can use to cope. Thank you very much. I'm happy to take questions at this point.
Thank you very much, Dr. Ajwa. I mean, your presentation was very insightful and very informative as well. I think the issue of mental health needs a lot of conversations like these. So at this point, audience, if you have any questions, please leave them in the chat box or feel free to unmute and let's do some Q&A. Maybe I'll take the first one whilst our audience gets prepared. So I know, for instance, what you eat can affect the way you feel. Can you just touch a little bit about how food can affect one's mental health in terms of depression, anxiety? There's certain foods that you take and suddenly you feel butterflies in your stomach or you feel nauseous. Is it the food that is causing it, or there are other issues that haven't been dealt with?
I'm happy you've asked this question because now I can talk about my weight management program. Yes, there are foods that improve mood. Usually keto diet. The keto diet improves mood. So there's a lot of millions of research supporting that. So that when people come in with depression, we encourage the keto diet for them. It doesn't necessarily have to be keto, but any low carb diet improves mood. What it means is that a high carbohydrate diet or carbohydrates in general or sugars in general lower our mood. It's funny, just like I said with the substances, the nicotine, caffeine, etc. at a time you think it's helpful, but invariably it's what's making situations worse. It's the same with sugars. So you realize that when you're down or when you're feeling low, you want to eat something sweet, you want to indulge, but it becomes a vicious cycle because that food you are eating actually makes your mood worse. I hope it's understandable at this point.
Mm-hmm.
Apart from mood, other conditions that a low carb diet improves is a seizure disorder. So seizure disorders and depression or low mood, a low carb diet is very beneficial. A low carb diet generally keeps you more active, more in tune with your body and your mind. And again, it's of very little wonder that people who eat low carb diets end up being more sexual, end up being more likely to achieve pregnancy. So it's not just about the weight loss, it's about your physical, how you're feeling generally. You feel better about yourself, you engage better, and therefore if you're in a committed relationship, your sexual, your sex life is improved. And if you're trying to achieve pregnancy, you do that. If you are not trying to achieve, so usually with my clients, I warn them, if you're not trying to achieve pregnancy, it's important to start a contraception because you are definitely going to get to that point because of how you're feeling.
I see. Thank you so much, Doctor. Are there any other questions we'll take from the audience?
So someone is asking from social media, what do you think is the best defense mechanism when dealing with a narcissistic partner? Okay, so narcissists usually would engage in gaslighting. What gaslighting is, I mentioned it earlier. Yes, what gaslighting is they make you feel like you are crazy or you are the problem. They make you feel bad for talking about their issues. It's important to acknowledge this first so that by the time the person is doing it to you, you know that that's what's being done to you. Because when you don't notice it or when you don't appreciate it when it's being done to you, you actually feel low, you actually feel crazy. For instance, assuming I am married to a narcissist. First of all, let me talk about what narcissism or who a narcissist is. Someone who is self-involved. So everything is about them. And usually it's because they naturally feel low about themselves. It's usually because personally, they don't feel that great. And so they indulge in themselves, they keep reassuring themselves, they avoid any form of negativism so much, and they make others around them feel low so that they can feel good. It's because of an inbuilt feeling or an inward feeling of inadequacy. That's what starts their narcissism. And so rather than push them aside or label them, they actually need help.
Right.
But the people close to them suffer because, again, we talked about defense mechanisms. His gaslighting or her gaslighting or their making you feel down or low is in order to keep themselves up. It's in order to keep their ego up. Remember, we said defense mechanisms help the ego. So that's his defense mechanism. It's a very poor one that affects everyone, including themselves, but it's what they are doing. And so you suffering it should first of all be able to realize that this is what is being done to me. There's a time that it gets to a point where I've seen a lot of such relationships. It gets to a point where usually it's men. I'm yet to see one that the narcissist was female. So the woman in the relationship starts questioning her abilities. She starts questioning herself. She starts questioning her beauty. And then she starts feeling as if it's all her fault. So whatever it is she's complaining about in the relationship. So you talk about, say, you barely listen to me these days, or we hardly talk these days. Is that what you think? Why are you thinking like that? What is making you think like that? Do you realize that you are the problem? And when you are with such a person, you find yourself constantly apologizing for something you thought was a problem the two of you should discuss. So the first thing I will say is notice it. Notice when you're being gaslighted. When you notice it, it helps you get to a place where you can defend yourself. And one of the defenses, like we talked about, would be humor. So I use humor in so many ways personally. I started using humor when I had to go for interviews, and I have crazy anxiety when I have to face people. And so what I would do is I would laugh at myself. I call myself Mami Ansuma, so I'll go like Mami Ansuma, no. Wow, hey, sister ni. So by the time I'm facing the people, I'm all smiles and they think it's because I'm confident, but it's because I'm laughing at myself inside.
Right.
Another thing I do these days is noticing all these gaslighters, and it's not even just with relationships, at work. It's so bad at work for most people. For most people, the only way they can feel better is to bring you down. When you notice it, then you
Hello, doctor. I think we've lost you for a second. I don't know if you can hear us. There's another question. So if you can just answer this very briefly, since we are out of time. Doctor, can you hear me? Hello, Dr. Ajwa.
Can you hear me?
Okay, I can hear you now. We'll take the next two questions. If you can just
Hello.
Answer as brief. Hello, Dr. Ajwa, can you hear us? Hello, doctor.
Hello, am I still audible?
Yes, you are very audible. We'll take the next question. It says, what do I do if the support doesn't help? If you can just answer us briefly in under 30 seconds to a minute. There are two questions in the chat we need to address before we close the conversation.
What was the first one, please? I didn't get you.
The first one is, what do I do if the support doesn't help? And the second one is, does our temperament in a way cause some people to be more depressed than others? So kindly answer these two questions within a minute.
Okay. The support, I'm not sure I don't know what exactly the person means.
Probably they're asking for help.
And so
I'll
give them a chance to So I'll take the temperament bit. I'm not sure what you mean by support. But yes, so remember we talked about the things that affect our mental health being a number of things, our personality traits, our temperaments. So yes, the kind of temperament you have as an individual can make you more likely to suffer a depressive episode or not. People are naturally, what's the word? Melancholic. They are naturally always down, always low. So in a mental health assessment, during our history taking, etc., we ask what your pre-morbid personality is, what your personality was, or the kind of person you were before you had the illness. This is because we know that can affect or increase your chance of developing one illness or the other. I'm not sure what they mean by support, so if they can come again with that.
Okay. While we wait for that, would just like to take some closing remarks from Sheena. Sheena, you have the floor now.
Hi, good afternoon, everyone. Thank you so much, Dr. Ajwa Jamira, for this very important presentation. This was very, very needed in these crucial times we are in. And for those of you who don't know, not only is Dr. Jamira the head of the psychiatric department at the Cape Coast Teaching Hospital, she's also a weight management coach. So she does weight management also online, and hence you can project your social media handles for people to follow, and those who want to contact you, they should be able to do so. We thank you so much. We hope we will be able to do something, a collabo in person, an in-person collabo with you regarding mental health or psychiatry or anything like that. So thank you once again, and thank you everyone for joining today's session. It wouldn't have been possible if we didn't have you all joining. So thank you so much. And thank you to Amma for moderating this section.
Thank you very much, Sheena. So while we wrap up the conversation, my last 2 cents will be that we live in a very opinionated society. And so it's very important for all of us to protect our mental health. So thank you very much, Doctor. Thank you very much for everyone who has been able to join the conversation. I'd kindly like to remind us of the upcoming activities that we have for the rest of the year. So Friday, 25th of November, as you know, the YP networking is coming on. And then 1st December, prostate cancer awareness also is coming up. So please endeavor to sign up and register for all of these events. And the last but not least, 25th of December, we have a collaboration, a donation where we are going to do Christmas with the kids. So please make sure you endeavor to be part of all of these events. Thank you so much. Doctor, can you share your social media handles while we say our final goodbyes?
Yeah, am I still audible?
Yes, you are.
Okay, so I'm your keto coach, your _keto _coach.
Okay.
Your keto coach on all social media pages, Instagram, Facebook, Twitter, your keto coach.
Okay.
I'm more
I'm
active
leaving it in the chats for everyone.
Yeah.
So you can have a look at it. So thank you so much. Thank you, Doctor. Thank you everyone for tuning in. It's been an amazing conversation. At this point, we draw the curtains to this conversation on mental health. I'll see you all in the next event.
Thank you. Bye.
Thank you. Bye.
Thank you, Doctor. Bye-bye.
Bye.
Bye.